Hey, welcome. Thank you for joining our show. This is Healthful Conversations, where we talk about different things that are going on amidst the coronavirus and, us being quarantined and stuff like that. How can we take care of our mental health throughout all of this? So last time we talked about anxiety, how to recognize some of the symptoms. Today we're going to talk about the mental health of the clinical medical professionals that are the frontline soldiers right now, our heroes in this time of crisis that we have nationwide, worldwide. So I brought in someone all the way from New York who's visiting us today, Stephanie Rodriguez. She is a medical intensive care unit nurse at the Buffalo General Hospital. Stephanie, hi, welcome.
Hi, thank you for having me. It's a pleasure.
Thank you for joining us. We really appreciate it, and we appreciate everything that you do. Everything. I mean, you guys, like I said, are the real heroes in this story. And we just want to know, how are things going over there? How are things going in New York?
I think one word that can sum it up fairly well is stress.
Okay.
A lot of people, a lot of workers that I get in contact with, we all can say one thing in common is that we're all stressed out. We're all stressful about this situation. A lot of my coworkers, we summed it up. We were talking to each other, and I realized that we all have the same three problems: lack of sleep, panic attacks, and then just anxiety going into work and coming home.
I can imagine. I mean, it's like I said, you guys are in the battlefield and dealing with all of these things, and everything is changing constantly throughout, by the minute, really. And you guys are treating all of these sick people, and wow, I can't even imagine the levels of stress that you guys are going through.
Yeah, it's amazing what one virus, a small thing, something we can't see, can impact us greatly. I spoke to a lot of just people, not nurses. There's also anesthetists. There are respiratory therapists, environmental services, certified medical assistants, the nurses. We are all trying to handle this as best as we can. But of course, this is something new. We're not prepared for this mentally, emotionally, financially. So it's a learning step every single day.
Awesome. Well, you know what? I salute all of you guys, everyone, the whole team that's involved. And again, I want to thank you guys for what you do. So I want to move into talking about how we can protect the mental health of our medical professionals. What are some things that you do or to protect yourself, like any self-care?
Oh yeah, of course. So I noticed that I made a routine without even realizing it. Okay. I'll come home, take everything off, put it straight to the washer, go straight to the shower, and I will stay in the shower for more than I should. But it's a way to just wash off all the stress that I've experienced that day. A lot of people don't understand is that medical workers or those who are essential workers, we wake up, we're stressed, we're anxious, we go to work, we're still stressed and anxious, and then we come home, we have to teach ourselves that what happens at work, you have to leave it at work. For me, it's once I get in the shower. When I take that long shower, I wash everything off, and then I come out, I feel renewed, and I'm able to go to sleep better. I notice that when I don't go, and if I'm in a rush trying to go to sleep so I can wake up the next day, I carry the baggage from yesterday, and it's never a good thing to carry baggage from the next day. So I think that what's helped me. I know talking to family members helped me as well. A lot of my coworkers, they are having like get-togethers through Facebook or FaceTime or whatever other technology, social media there is, just to talk to each other, vent about what's going on. And when we do that, we also teach our family members how to stop the spread of this from what we've seen and what we know.
Yes, that's awesome. So it sounds like you guys are also practicing that social distancing, but also trying to take care of yourself. I love how you said having some kind of transition or ritual where you can leave work at work and be present when you're home, right? It's very important, because when you bring everything over with you, you don't really get the rest that you need in order to help you for the next day. So that's very important. Some people, they use closing the door as a symbol of being able to just kind of disconnect from the workplace. And I love how you said that you take showers just to kind of get all of that stress, symbolically get rid of the stress and some of the worries that you may have had. Those are some really good ways that you can take care of yourself. Staying connected also is very important, having that open communication. And I think also being aware of the feelings that what you're experiencing, right? Whether it's anxiety or fear or whatever, being aware of that and actually talking about it definitely dampens the power that it can have over you. Helps you recognize some of those symptoms. So I really like how you're doing that. And I think that's something that, it seems very simple, but we definitely want to encourage other medical professionals to also consider doing that as well. Taking deep breaths, just having like a quiet moment or whatever helps them to better decompress at home. What are some things that we can do as a community to support you guys?
Stay home. I think that's the biggest thing. I think people are not, because you don't see what I see in the hospital. You don't see the virus. We have this, as humans, we have this flaws that if I don't see it, I don't believe it.
Right.
And I think that plays a huge role as to why the virus is spreading, as to why people are not taking it as serious as they should. If you can wear my glasses for a whole day from work and you can see what I see, not only old people, because I think people have this stigma that it's only going to affect the older generation, 50 and above. Actually, it's not. It's affecting 20s to 44. And then we even see young people being affected. Yeah. So if we can see, put on my glasses, and you can see what I see when I walk into work, a young person, ventilated, tubes everywhere you can think of, trying to keep them alive, fighting this virus as the best we can. And people forget this is new. We don't have a vaccine for it. We don't have the treatment. We're going based on really new evidence, and it's not really supported because it just happened. So we're trying everything that we can to stop this, treat the symptoms as best we can, and pray to God that that person gets better. If you see someone young in that state, you would stay home. Yeah. You would not go out. You would not go to the park. Oh, it's a lovely day. It's 50 degrees, or over here it's pretty warm, 50. But if it's sunny, I want to go out. I've been in the house for 2 weeks. Stay at home. Figure something else. Pick out something that you can better at. A trait, not a trait, but what am I trying to say?
Like a self-improvement.
Yes, yeah. Choose something. Oh, you used to draw back day. Draw again. Do something to keep yourself busy at home. Because when you step out, you forget that you can be infected, or you can spread, or you can show other people. If I see someone walking down the street, I question, why aren't they? Why am I home? Why can't I go out? So I think if everyone stays home and everyone sees that, it'll be a domino effect.
Awesome. Well, we could definitely probably do better at as a whole, right? Because like you said, I don't think everyone's taking it seriously. When I had one of my family members, two of my family members that are just watching them fight for their life, going through this virus, it really was eye-opening for me, and it hit home, and it's like, okay, this is real. And I started doing even better, being more precautious in what I'm doing. So that is some very good advice. Thank you so much. Lastly, I just want to say to people who might be interested, one thing that we did to help support the nurses and the medical staff that were taking care of our family, we provided them with some donations, like lunches or food or whatever, anything that can help, because we really want to encourage our nurses, encourage everyone, the whole medical team, and let them know that we really care, and not calling too much, throughout the day, letting people do what they do. But also at the same time being positive in our interactions and expressing our gratitude and our appreciation. I have found that doing that has really kind of lessened some of the stress when we talk to some of the nurses that are taking care of my family, specifically. I'm pretty sure that can go a pretty long way.
Oh, definitely.
Yeah. Well, thank you so much for your time. I won't take up any more, but I really am so grateful for, like I said, all that you do and for sharing with us these nuggets. And for those of you who are joining us new, please subscribe to our channel so that we can keep having these conversations and spread the word of how we can stay home, be safe, and survive this quarantine crisis with these helpful conversations. Until next time.